Through the Health Humanities and Society minor, you'll be able to understand U.S. healthcare and healthcare in general, not just as a health system, but also through political and social and cultural perspectives that really broaden the possibilities of what medicine means.
The Health Humanities and Society minor is necessarily interdisciplinary. You can hear all the commas in the name. Learning about healthcare doesn't mean that you have to be in healthcare in the future.
It really doesn't matter what your major or your minor is. It was a really great way for me to engage with and realize that there is such a wide world outside of just being a doctor.
The healthcare system is not just people working to treat other people. It's also this giant structure, an institution.
Looking at what are the gaps and the really critical issues that we need to think about outside of just the medical world. And so that's looking at social relationships, looking at structural factors, the political engagements.
How the government influences not only the healthcare system, but people's actual healthcare outcomes. The Health Humanities and Society minor allows me to explore topics like disability or mental illness in intersection with culture and identity and history and the legacy of those things, the impact of those things on how people are treated now.
Medicine is changing rapidly, just as the world is changing really quickly. Even technology, things like AI or new treatments, which are all really important to know about and learn how to use. But HHS has allowed me to kind of look at the flip side of what does business, what does technology ignore.
The Health Humanities and Society minor is 5 courses. The first 2 required classes are Contemporary Concerns in Medicine and then U.S. Healthcare in Perspective.
The Health Humanities and Society minor also has an incredibly wide range of electives that you can take, and you can really use it to build on whatever interests you want. So for me, that's been a lot of stuff around mental health.
Healthcare interacts with every aspect of human identity. It interacts with every aspect of culture and people's ethnicity, people's gender, disability status. The interdisciplinary nature of Health Humanities and Society really allows you to bring all of these interests together in really every major you could possibly have.
Looking at, for me, the social and the anthropological side of things, and using HHS as a way to bring that all together and really expand the worldview of what's possible with health policy.
By being Notre Dame students, we are trying to equip ourselves to be productive and beneficial members of society, not only to make it function, but to make it good, and to make it good for all people.
Health Humanities and Society has been really influential in that regard and allowing me to kind of build on these kind of humanistic inquiries about healthcare and understanding, okay, what are the critical issues of today and what are the ways that we're able to solve them.